I'm very proud to say that we're delivering the best primary care pediatrics in the city, in the state, one of the best in the country. Our families here in the Brooklyn area have to travel a lot less further than they had to before for those services, and we all work together to deliver the best possible care.
Good evening. Thank you so much for joining us. My name is LaChanze, and I'm so happy to have to be here able to talk about one of the most important issues that I think we as women need to focus on is our health, if not the most important, next to our families. Welcome to Playbill's Centerstage with Healthcare Heroes. I am so excited to introduce two dynamic sheroes. We have a lot of heroes out there, but we also have some sheroes, and we're so thrilled to welcome to this panel discussion today, Dr. Nivea Amin and Dr. Loeb Zeitlin. Thank you so much for joining us. Please tell us a little bit about who you are. Let's start with you, Dr. Amin. Tell us a little bit about who you are and what your specialty is.
Thank you so much. First of all, thank you for inviting us to be part of this. And I'm so thrilled and honored to be on center stage with you, LaChanze. So thank you for taking the time as well. I'm Nivea Amin. I'm the director of our Women's Heart Program here at Weill Cornell, and also the director of Preventive Cardiology, associate director of Consultative Cardiology. So what that means is that I see a lot of everything, but have a special interest and focus in women's health and the prevention of heart disease.
Wonderful. Wow. Just a little title there. Thank you. And Dr. Zeitlin.
Either way is fine. And I'm also thrilled to be here. It's so nice to meet you. And love being a shero, actually. But I'm assistant professor of clinical obstetrics and gynecology. But for the past 17 years or so, I've just been doing gynecology. Actually, when you talk about health and lives, I gave up my obstetrical practice when my children were little, and to kind of get a really good work-life balance. So I see women of all ages, from teens into women, and I saw women this week in her mid-90s, and I deal with women's health from start to finish. Sometimes I have 3 generations of women in my practice, which I just love. I want to put a plug for my son, who's a huge theater buff, and reminded me that we saw you in If Then many years ago.
Oh, yeah. I love working on that show with Adina.
Yeah.
Yes. That was wonderful. Well, thank you so much. And tell your son, thank you for coming. The sun is coming. The sun is right behind me. I hope you guys can see me okay. It's pretty bright right behind me. But anyway, we're going to jump right in with some of these really incredible questions because they're so important. And the first one I want to start with is, what are specific lifestyle measures to improve your gynecological and heart health that women can focus on today? What are some of the lifestyle changes that we can make? Let's just start with a very broad question, because I'm sure we've heard things, but and we all have our fad diets and the things that we follow, but it's really helpful to really know the science of it. So I'd love to hear from you, Dr. Amin. Would you mind taking a stab at that?
Great. The key to leading a heart healthy or overall healthy lifestyle, both for heart health, gynecologic health, and overall health, is to really pay attention to the food we eat, trying to stay active, and managing our stress, our mindfulness, mental health is so important. So for the foods we eat, we want to go for lots of fruits, vegetables, lean proteins, trying to get at least moderate exercise, at least 30 minutes a day, most days of the week. If you want to be even more vigorous with it, even better. And taking some time for oneself to really just recenter, focus, understand all the stressors, and see what we can do to pull those away. I think those are some keys to a healthy lifestyle.
I think what people don't even realize today, particularly during the quarantine, is the micro stressors, the things that we may not think are stressful to us. But we're all living in this abnormal time, and we've been living this way for a while. And I'm sure that does cause a lot of stress for people that they may not even identify with.
Absolutely.
For sure. And I think, healthy eating and healthy exercise are the key. Not too much eating, not too little eating, right? And not too much exercise and not too little exercise either. They both can really affect our overall health. And we see gynecologic things coming up when women go both ways with those things. Alcohol, similarly, a lot of women drank a lot of extra alcohol to get rid of some of that stress during this pandemic. And we're seeing weight gain and just other impacts of that. So that's another really important lifestyle thing that we have to pay attention to right now.
No, that's true. Is there would you say that exercise, this is something my mother used to say to us all the time when we were my daughters, my sisters and I, is when in terms of like menstrual cycles and irregularities and things like that, not to get too specific, but doesn't stress affect that for women?
100%. I can tell you how many phone calls I received during this pandemic with menstrual irregularities, either skip periods, bleeding in between cycles. But of course, it affects menstrual cycles. It affects fertility. And another one I got a lot of during the pandemic were women who wore their yoga pants all day and ended up with a lot of yeast infections.
Whoa. You wouldn't even think of that, though.
Right.
So that's a perfect segue into this next question for you, Dr. Loeb-Zeitlin. So what should every woman discuss with their gynecologist to improve their overall health and prevent cancer?
So everything, right? From head to toe, I always say, and I teach the medical students this, the relationship a woman has with her gynecologist if you allow it to be, is a really, really unique relationship. Mm-hmm. And sometimes I'm the person that you can tell things that you can't tell anybody else in the whole wide world. And it's a very safe place. So starting with, we go through, like we started menstrual history, pregnancy history, fertility concerns, menopausal or perimenopausal concerns, which I'm happy to talk about. Actually, at the beginning, I meant to mention that I'm leading a midlife program for Weill Cornell, and we're talking a lot about that. That's a big transition in women's lives. Any kind of gynecologic concerns, fibroids, ovarian cysts, discharge, history of sexually transmitted infections, all of those things. And this is really for women of all ages, starting in teens, going, I've sexually active women in their 80s. We have to talk about all of these things with our patients. And like I said, just earlier, smoking, drugs, alcohol, domestic violence, those are things that we can talk about. Like I said, it might be a safe place for people that they can't talk about in other settings. In terms of, and all of those things taken together can really improve a woman's health because we take the patient as a whole and consider all of the things that are going on in her life. So I'm not a therapist, but I do a lot of therapy in what I do, because really when you consider a family situation, social situation, and all the other problems, sexual things going on in a woman's life, we really do a lot to hopefully improve her overall health. I can go on and talk about, cancer prevention. Of course we do screening. Yes. And the point, we want to make regarding that is, the pandemic might have slowed things down for people, but really, really it's time to catch up now on some of the screenings. And, of course, different societies disagree, but typically around age 40, we'll start doing mammograms. We send for colonoscopies, depending on family history, but by age 45 or 50. And skin checks, those are all things that we can't forget and that we'll pay attention to and refer to from our office. Yeah.
It's interesting that you say culturally that there are issues that like some cultures differ with when you should start a mammogram or when you should start these particular preventative cancer screenings. It's so fascinating. I have a very young person close to me, and she had her very first gynecological exam, and she's 19. And I asked her how did it go, and she said they didn't screen me for a pap smear.
Wow.
And I thought, I thought she's 19. Shouldn't we start screening by that age? And she said that her gynecologist told her at 21 is when they start. But that sounds like it has nothing to do with the body, more to do with the law, correct?
No, that's a really good question. And I was hoping to get to that tonight, because pap smear screening is complicated in that patients are so used to getting annual pap smears, but it's actually based on science, what you're saying. And so under 21, we don't do pap smears. Why? I'll tell you why. Because especially before the HPV vaccine became available, the Gardasil vaccine, many young women who were sexually active actually did have abnormal pap smears and maybe were exposed to HPV. However, in the young, healthy women, that'll go away. And it's so much worse to tell a young woman that she has that than it is to actually have it.
Okay.
And it will not become cancer by the time she's 21. We know that. And so therefore, typically we will not start screening with pap smears until a woman is 21.
Oh, okay. I didn't understand that. I thought that was interesting. And I wanted to discuss that with you today, because I thought, 21. That's also the legal drinking age. So does that have something to do?
We can talk about that too.
We have a cocktail and then go get a pap smear? Like, what is
having safe sex though, of course, right?
So,
but if we can talk a little bit more about screening guidelines with the pap smear, actually the guidelines do say that women over 30 should be screened with a pap smear and HPV. And HPV is pretty much the cause of cervical cancer. And if the PAP and the HPV are both normal, the guidelines say that you actually can have a pap smear in 5 years. You don't have to do it annually. Now, that is a very hard thing to convince women who are so used to their annual pap smears. So in clinical practice, we make some kind of compromise usually, because 5 years does seem like an awfully long time, but it is perfectly acceptable to do a pap smear every 5 years.
Oh, wonderful. That's great to know. Thank you for that. Here's a question for you, Dr. Amin. What should every woman, do with PCP about their heart health and to prevent future heart disease?
So every woman should talk to their primary doctor about their basic numbers.
Mm-hmm.
I want to tell you why this is important, and I'll get into some of the details. There are many factors that contribute to a woman's or a man's, but any individual's risk for heart disease in the future. And knowing the key factors and knowing one's numbers can help give attention to conditions that can be treated and potentially prevent heart attacks, heart failure, stroke, death in the future. So, did you know, before I go on, did you know that heart disease is the #1 cause of death in this country for women?
I thought it was diabetes. I had read that it was diabetes. Heart disease?
Heart disease.
For women.
Women. Yes. So this is what's so powerful. If women can understand their own risk, if society, if doctors, everyone can understand risk in women and men, of course, but we're here to talk about women. We can prevent so many untimely deaths, so much disability. So let's talk about what a woman would want to talk to their primary doctor about.
Yes.
I tell my patients to know their numbers.
Okay.
So what are those numbers? You want to know your blood pressure, your BMI, body mass index, which is a ratio of height and weight, tells us about factors that contribute, whether you're in the obesity range. Also want to know the fasting blood sugar and your cholesterol numbers. So these are all factors that go into one's heart health risk or heart health. If people have high blood pressure, that's a contributor to future heart disease. High cholesterol is a contributor, obesity, and to your point, diabetes is a contributor to future heart disease. So knowing these numbers allows a woman to then engage in further evaluation, further conversations. Maybe it's time to see a specialist. Maybe it's okay to continue with one's primary doctor.
So I'm sorry, I didn't mean to cut you off.
No, go ahead.
No, please continue. I have a question, but I'll hold it.
Well, I just wanted to also say that it's really important for a woman to review their female-specific history. So considerations about pregnancy, whether there were any complications during pregnancy, because this could potentially give a signal that this woman is at increased risk for heart disease. Whether a woman goes through menopause early or needs specific treatments that cause them to go through menopause early, that's something important to discuss with their primary doctor, because this can then highlight need for closer screening later on. And Dr. Loeb-Zeitlin can probably discuss all of these topics in greater detail as well, but also considering hormone replacement therapy. Timing of hormone replacement therapy, whether it's safe, whether it's not. Hormone replacement therapy is incredible. It helps so many women, but it can put women at increased risk for heart disease and stroke in certain scenarios, as well as cancer.
You know, it's interesting that you bring that up. I am a woman of a certain age. And one of the things that I've been reading a lot about and is in discussion, I'm hearing women talk about, and Dr. Loeb-Zeitlin, this is something maybe you might know about, something called Bioidentical pellets. It's apparently supposed to be they're calling it the natural hormone or the well, you can speak more about it than I can. These are just coffee table conversations about, because I do agree that the hormone replacement, these are conversations that women are having around me, and we're discussing the pros and cons of it. But the one that has the hot topic right now, or that's what's getting the press, and maybe you can tell me why, but the bioidentical hormone replacement. Can you talk a little bit about what that is?
Sure. But I have a bias about it. But
okay, well, please.
Hormones are hormones are hormones.
Okay.
And they are definitely, as Dr. Amin was saying, really good for a lot of women. But we have to consider the risks and benefits. But bioidentical was sort of a marketing term. Like we're a little young for this, but Suzanne Summers was big on that, and it was a big marketing tool. And we, as I said, we're doing a midlife women's program, and we pretty much feel that, the estrogen that we give, that we'll usually prescribe, is also bioidentical, but it's FDA approved. And these bioidentical pellets are not. And so we can be regulated a little bit more, and we know more what's in it, and we can adjust them a little bit more. So my bias is that's, for some women it's right, but that's not typically what we don't prescribe the pellets. And typically we don't go for bioidentical because they're compounded and they're not necessarily regulated as much. And like I said, the estrogen patch that I give is the identical hormone to your body's hormone. So therefore it is bioidentical, but it's not marketed as such. Okay.
And I think just for our audience, we should let them know what the pellets are, because I thought that was fascinating. It's something that's inserted under the skin, correct?
Right.
And you have to get this insertion every few months.
That
turned me off right away. I was like, nope. So Dr. Loeb-Zeitlin, I might be coming to you.
Love it.
Information with my friends and bring that up. That's really good to know.
Love it. We actually, and we'll talk about this a little bit, but this program we're starting, we're actually doing it for busy women. We're doing it by telehealth because it's a great way to have a conversation about these midlife issues. In a relaxed environment. Yes. And then when you have to come in, we bring you in. But to start the conversation like this, it's a great way to do it.
Well, I hope we can get the information for that to share with our audience, because I'm sure everyone wants to know more about that. So here's another question for you, Dr. Amin. When should a woman see a cardiologist?
A woman should see a cardiologist if they are having any symptoms that may be concerning for heart disease. I know that sounds like an obvious answer, but heart disease in women can manifest in many different ways and in subtle ways. So a woman who might be experiencing chest pressure, some strange chest tightness, trouble breathing, any of these symptoms, especially when they're trying to exercise or move around. So if they're having symptoms, they should seek care. Also, a woman should see a cardiologist if they have a strong family history for heart disease and may have other risk factors, and they want to get on top of their preventive and even diagnostic screening early. So women who know that they have a family history for heart disease, let's say a father who might have had heart disease quite young in their 40s, or a mother who had heart disease in her 40s or 50s. These are considered young ages to have heart disease in men and women. So these women should come and see a cardiologist. And if their primary doctor, and conversations with their primary doctors, they've determined that they have enough risk factors for heart disease or have any of the pregnancy complications, early menopause, or other questions, they should definitely see a cardiologist.
And it doesn't matter what age, right? It doesn't, like, it could be 25 or 55. It doesn't matter. If you have this history in your family, this is something that you need to definitely see a cardiologist about, just as a checkup, correct?
Yes, and just to take a look from the lens of a cardiologist. And that's what we're doing in our Women's Heart program, is really trying to identify women who are at high risk for heart disease so we can treat them early. So yes, 25, come in, make sure that you have your cholesterol in order and that there are no other red flag signals, and then check in every year, every few years, depending on the situation. And certainly, we collaborate also with women who may have certain symptoms during pregnancy, or who may have heart disease and need to be managed by a cardiologist during pregnancy. So these are the sorts of scenarios that would lead someone to the Women's Heart program, for example, or to a general cardiologist, depending on what's available in one's area.
That's great to know. You mentioned I'm sorry, Dr. Loeb-Zeitlin, you were
I was just going to say, I send patients to Dr. Amin all the time. She's amazing.
I love working with you, Dr. Loeb-Zeitlin. You know that. We collaborate so well together. Thank you.
This is a powerful sisterhood going on right here.
Yeah, right? I mean, Dr. Loeb-Zeitlin really has a lot of vision to really address midlife. And the reason I'm saying that is that I see women in my own clinic who are really not struggling, but really seeking just a more well-rounded and holistic approach to their care. And there's so many changes that happen in midlife. And I see this from a cardiologist standpoint, and I'm so thrilled that Dr. Loeb-Zeitlin is directing this program.
Well,
so
that's
hats off to you.
Thank you. It's such an interesting, I can age myself, but when I first started practice, in the late 1990s, women were given hormone therapy at that point like it was water, and it was going to cure everything from head to toe. And then in 2001 came the Women's Health Initiative study that showed possible increased risk of stroke, cardiovascular disease, and breast cancer for women taking hormone therapy. And we literally pulled it away from women at that point, kicking and screaming. So at this point, we're somewhere in the middle. There is a role for it. It's not for everybody. We have to consider the family history and the personal histories. But yeah, taking a more holistic approach, and the things that we talked about at the beginning, lifestyle changes, diet, alcohol is a trigger for some menopausal symptoms. So taking the patient as a whole, and yes, taking a holistic approach is really the way we're approaching the midlife.
That's wonderful. It looks like we have a question. Oh, a comment.
Comment.
From Esvital that says, "We are grateful and thank you for your service, Dr. Amin. We are proud of you. Love you. Your fans are out there. That's wonderful. Oh, here's another one for you. I'm grateful to Dr. Franklin for your service. You have been the best GYN I've ever had." That's fantastic.
Thank you.
When your patients can want to chime in and do amazing shout outs for you. That's fantastic.
I'm turning the same color as my shirt.
Listen, us actors, we like applause. I think a doctor needs more applause. I think we need what the work you're doing and what you're providing needs much more applause than what we get. So thank you so much. So here's another quick question for you, Dr. Loeb-Zeitlin. So how often should a woman see a gynecologist? That's actually a question for both of you, but I'll start with Dr. Loeb-Zeitlin.
I'm so glad you asked that question because the answer to that is annually. Now as we talked about, you don't need your pap every year. And so that's a big misconception. I don't need my pap smear. I don't need to see my gynecologist. Not true. And there's some debate whether or not even your exam and the pelvic exam is that valuable. But everything else we do is so important to talk through. And there might be subtle things that have come up that, as I said, you might not have addressed with anyone as you go through these changes. If you're experiencing vaginal dryness, that might be embarrassing for some women. If I ask you the question, I might do something that's life-changing for you. Another one that I meant to mention earlier is talking about family history, which really can change from year to year, right? Mm-hmm. And so your mom was just diagnosed with breast cancer. Maybe that changes something for you, and that might change some screening. And, either we do some more screening that we wouldn't have done otherwise. Maybe we do some genetic testing to look for familial cancer syndromes that might help detect cancer early in you. So things change from year to year. So we recommend annual exams and annual visits. And again, that's one of those big misconceptions. I had a woman that came in a couple of weeks ago, said, I'm here for my 5-year checkup, because she knew she needed a pap every 5 years. And I said, that's not what we meant.
That's interesting, because I would imagine every year too. So I'm getting an education here.
Every year is right. Every year, come and see me.
Wow. And what about for you, Dr. Amin, how often should a woman see a cardiologist or her cardiologist?
It really depends on the scenario or the situation. So a woman who's seeing their cardiologist for preventive cardiology care can usually see them once a year, once every 2 years, as long as they keep in touch in between, just having blood pressure checks, cholesterol checks. Some of my patients who were really trying to get on track, I'll see more frequently through the year, just to make sure that we're keeping on track for the cholesterol, the blood pressure, the weight, smoking cessation or stopping that tobacco is really important. So sometimes people need a few more frequent touch points. And I do take care of women who do have significant heart disease. While we do want to prevent it, we do take care of women who have heart disease. And some women I need to see every 3 months, every 6 months, or yearly. So it really depends. But for the the broader population, usually about once a year.
Okay.
And of course, I'll always see patients, of course, with a problem. My staff is trained. You call. Of course, we'll always get anyone in complaining of a problem, but especially breast. If you feel something in your breast, come on in. We'll check it out. Don't wait. So, So annually for routine well visits, and then in between for anything else you need.
So, Dr. Naveen, excuse me.
It's okay.
Mentioned the numbers, and this was something I'm curious about, because we hear that often as patients. What are your numbers? Give us your numbers. How can a woman actually get her numbers? I don't think I've ever known what my BMI is, my body mass index. I don't think I've ever known how to find out that information. So you mentioned you said the know your heart, your blood pressure number. You mentioned know what your blood sugar is. You mentioned the BMI. You mentioned one other thing, but can you talk to us about how we as women can get these numbers, and where should we get them from?
Sure. The main place that you can get these numbers are with your primary doctor at your annual visit. Okay. Gynecologists like Dr. Loeb-Zeitlin may also be checking this during clinic visits. So what every woman should do is have their smartphone out, or a pad of paper, a pad of paper and a pencil, and jot things down. Ask, when somebody measures your blood pressure, ask, what is my blood pressure? If somebody measures height, if somebody measures weight, often there are medical assistants helping before the doctor comes in. You can ask that individual and they'll give it to you. And certainly when you're talking to your doctor. if blood work is being checked as part of your visit, ask your doctor to consider checking your cholesterol or your fasting sugar. Now, it's really important for these labs for people to actually be fasting. So what does that mean?
Yes. What does that mean?
I'm a bit of a purist, and I will say that I have a little bit of a bias, but I really like people to be fasting overnight to get the most accurate numbers.
Okay.
But what if your doctor's visit is at 2:00 in the afternoon? So having a light breakfast and then just having some water in between should be okay. So doing about a 6-hour fast, as long as the meal is a light meal before that fast, is just fine.
And water, you can have as much water.
As much water as you'd like. Please stay hydrated.
Okay.
Do not proceed out into the world and say, there was this doctor, Dr. Amina, she just said, don't take anything. Please, please, please drink water if you're fasting.
You know, I'm noticing that our audience is a little shy. We don't have any questions because these are topics that may be a little sensitive, which brings me to my next question. How should you talk to a doctor about sensitive topics? What are the ways that you can make the patient more comfortable with asking these questions? And I can see by our shy audience that these are personal issues. These sometimes people are nervous to get the information. How would you suggest a patient talk about sensitive issues? I'll throw that your way, Dr. Loeb-Zeitlin, first.
Yeah, I mean, the answer is don't be shy, but of course I understand that that's hard. So I think some of the burden falls on us to ask the right questions, right? So are you experiencing problems with your sexual relations? Are you having, what's going on in your life? Opening up questions. I had a woman in yesterday who it took the entire visit until she really told me what was going on in her life. But so we have to warm up, right? But I say, at this point in my career, but even when I was first starting, there's almost nothing that a woman in the office can tell me that will shock me. Mm-hmm. And if we don't know the answer, we'll find a way to find the answer or refer you to someone who does. But that is what we're there for. But I do think some of the burden is on us to make it a comfortable place to ask questions and to ask leading questions that might get some information out. Yeah.
Oh, that's good. That's good to know.
Mm-hmm.
Dr. Amin?
Absolutely. I agree with Dr. Loeb-Zeitlin that a lot of it has to do with the relationship or the way the conversation is going. And it's up to us as clinicians to really try to open up and create an area of trust. But let's say you're in front of your doctor and they suggest taking a medication that causes one to urinate a lot, which is a frequent medication we prescribe in cardiology to get rid of excess fluid for people with blood pressure or heart failure. But a lot of women, and especially of the age where we are often prescribing these medications, already have some incontinence. So it's really important for me as a provider and for any provider to know that you're having this difficulty or that an individual is having this difficulty so that we could think of alternatives or think of strategies to make things work out better for each individual. So just trying to also just be confident in the idea that doctors need to know pretty much everything. They need to know what individuals are experiencing in their personal lives, in their, in intimacy or other considerations like that, so that we can piece together the entire picture. And that gives us a better insight into our patients. It also helps build that trust. I always tell my patients that it's not only about them trusting me, it's about me feeling that I'm connecting with them so that I can make sure that what we're communicating with each other is actually resonating and it'll lead to a better therapeutic outcome. So don't be shy.
I had my primary care physician. She's retired now, but I met her when I was in my early 20s, and I just fell in love with her. She was pregnant, and I thought, oh my God, this pregnant doctor, and she's so amazing. And when she retired, I was heartbroken because I thought, well, what am I going to do? You can't retire. You can't go have a life. And, but one of the things that I was always very appreciative of about her was she would always start my annual visit with a series of questions about just my mental health. And I thought that was initially, I was a little, I don't know, I guess I was shy. I didn't necessarily want to talk about how I was doing emotionally or mentally. I thought that wasn't what I was at the doctor for. I thought she was just supposed to take my blood pressure, my weight, check me out and everything. But she would sit down with a pad and she would ask me all kinds of questions as if I were in therapy with her. And she'd want to know about my relationship. She would ask a wide variety of questions. And it became, throughout the years, I looked forward to my annual visit with her because I knew that she knew all of the information, and she explained to me as we became friendly later on in life was that is what your health is not just your body. It's not just your physical health. A lot of health starts in your mind, like the stressors you were both speaking about earlier, how, things can stress you and then create problems with your physical health. But understanding what's happening mentally in your mental health is also, I think, a huge, a lot of information that you should have in also how to maintain your physical health.
100%. Can't agree more. In fact, I cheat a little and I write notes. I used to have a good memory, not so good anymore. So I write notes. Daughter got married last year, or, husband passed away, or whatever it is, so that we can start the conversation rather than, so that we know how things are going. So I cheat a little, but it does make a difference.
It really does. And I value that.
Mm-hmm.
So, here's another question. Oh, we have a question from the audience, someone that's not shy. All right, here we are. Are there any side effects from the COVID vaccine on gynecological health?
Great. I was hoping we'd get that question. I thought it might be asked a little differently. In terms of general gynecological health, absolutely no. We talk a lot about the question with pregnant women and women who want to one day conceive. So there is no plausible biologic reason why it should affect fertility. So we are encouraging women who plan pregnancy to get it and get it before they're pregnant if possible, because having COVID during pregnancy is not a good thing, right? Women are sicker when they're pregnant, end up in the ICU more. Fevers are not healthy for pregnant women. So getting it before you're pregnant is encouraged, and there's no plausible reason why it should cause any kind of risk in terms of getting pregnant. We are even encouraging pregnant women to get it. Maybe not the woman that is home and not going anywhere. All right, she might not need it, but we're all going to start going places soon. Yes. And, from the beginning, we've been encouraging women in all trimesters to get the vaccine. The benefits, there's no evidence that it's not well studied, although there were about 20,000 women in the initial studies that incidentally ended up pregnant and they did fine in the vaccine studies. So, yes, pregnant women can get the vaccine too, and we don't know any bad effects other than the effects that everybody else is getting from the vaccine.
I see. Dr. Amin, what about for cardiology?
We are encouraging all of our patients to get the COVID vaccine. Mm-hmm. And there are no adverse effects on the heart. In fact, people with high blood pressure, diabetes, and then people with heart disease are those who are highest risk for complications from COVID. Mm-hmm. So we're encouraging all of our patients to get the vaccine to protect themselves and also protect their family. And the only reason to not get the COVID vaccine is if there is a true severe allergic reaction to any of the components of the vaccine. And if an individual's had a severe reaction to any other vaccine, they should discuss with their doctor first before getting the COVID vaccine. But we are out there pounding on doors. We want everyone to get the COVID vaccine. It is safe for all, and we've all received it as clinicians, and we're here to talk to you. Not about the vaccine, but about this.
Right. It's the only way we're going to be able to move on with our lives if enough people get vaccinated.
Agreed.
I think a lot of us are in agreement that it's time to get out of our shells, and if the vaccine is going to be our shells, meaning our homes, if the vaccine is the way to help us move forward, then I think we all should be huge advocates for it. I know I am.
We want to see you back on Broadway.
Oh,
come on.
Trying to get back on stage. Just trying to get back on stage. We're overdue. We're so overdue. But the vaccine is something, and I like that how it, particularly in New York City, how we definitely have worked out a really positive vaccine program. So I'm thrilled to know that it's. I think as my West Indian friends say, soon come, soon come. So I look forward to getting back on stages. I really do. Yeah. So you both mentioned telehealth earlier, and that's something that I have to be honest, I know what it is, but I've never had a telehealth visit. And so can you talk a little bit about how telehealth sort of works in gynecology and in cardiology visits? Like can you talk a little bit about a telehealth visit? What actually happens, and how effective are they these days?
Oh, I love them. I think they're amazing. And again, it's a way to get to know a woman in her own environment. I'll give you a great example. In the peak of the pandemic, when women were pulled in so many different directions, and this one woman said, I can't even get a moment to myself. I see her 2-year-old climbing all over her. It's really a way to get to know a person in their own environment. Sure, we can't do an annual pap smear, or I spoke wrong. We can't do a pap smear or a pelvic exam. We can look at skin changes. I've seen some skin changes. There was a meme that went around early in the pandemic with a woman with a laptop between her legs saying GYN exams of 2020. That's how we weren't doing that. But it's a great way to do counseling visits. Like I said, the midlife issues, it's a great way to do it. But also if you have contraceptive questions, or any kind of medication questions, or just mild symptoms, and you're not, you should be comfortable coming in. We're using so many precautions in the office. Everybody is masked and washing their hands. But if you're not comfortable coming in, there are so many things that we can discuss on telehealth. And it's a great way to do just a counseling visit with a woman.
And for you, Dr. Amin?
So we're doing a telehealth visit right now.
I was just going to say that, right? I was going to say that.
Yeah. And this is how it works. We get on the screen with our patients. We see each other and we chat. During the visit, for cardiology visit, so much of what people visualize about a cardiologist is their stethoscope, but there's a lot to coming to our assessment that goes beyond the stethoscope. It's about talking to our patients, understanding what's happening, diving deep into that, and we can do that with telehealth. I have patients who we monitor their blood pressure. I can check if people are retaining fluid, which can often be a sign of heart failure. Mm-hmm. And I've met so many people for whom telehealth has been so much more convenient. Just the same thing, taking care of families. They're stepping away from work where they might have otherwise had to take a half day, full day off just to come and see me. And what it allows us to screen our patients and then use their time wisely, direct it towards, okay, you need to come in and see me in the clinic. Let's not beat around the bush. Or this can be solved by, let's do some tests, come in safely. We do social distancing practices here at Cornell. And all of our staff are masked. Everyone is asked to keep their masks on. But even beyond COVID, I really think that there is a role for telehealth. And I think it's going to be a great equalizer for the busy mother or the busy spouse who's taking care of a household or taking care of an elderly family member. the woman from, a different socioeconomic background who needs to run between 2 jobs and her family, she can step aside and get medical care on the go. So I think it really allows us to open up the doors to more people. And of course, when people need to come in for the exam, when they need to come in for the test, they come in.
That's great.
So,
That's wonderful. And students too. College.
Oh, yes.
College students, I think, they're out there on their own learning how to take care of their health for the first time. Telehealth might be a great solution for the students as well. So ladies, this conversation, we can talk about this for another hour, literally, because I have so many questions, but it seems like we've come to the end of our time. Thank you so much. You can visit, they had it up on the screen, but now it's gone. There it is. If you have more questions or want to learn more about the wonderful programs that the doctors have over at Weill Cornell, please visit, as you see it on the screen, weillcornell.org for more information. But I just want to say thank you, ladies, so much for sharing your expertise with us today here at Playbill for the Centerstage with Healthcare. Here, our Sheroes. It's so exciting to know that we have our Sheroes making sure that we're healthy. We all need to be healthy. We all need to focus on, as women, as mothers, as daughters, as sisters, as wives, we need to focus on the health so we can be there for everyone else. So thank you.
Thank you.
Thank
So much
you.
fun. Don't remember not to delay your care because of the pandemic.
I
Yes.
was just going to say the same thing. Do not wait. Call your doctor's office. Get your care.
Very important.
Thank you so much. It was
Thank
such
you.
a
Can't wait
pleasure.
to see you on the stage.
I can't wait to get on the stage. So this has been fantastic. Thank you again so much. And thank you for tuning in. And please continue to watch all these wonderful programs that Playbill is set up for the center stage with our healthcare heroes and sheroes. And until the next time, I'm LaChanze. Take care and thank you again.
I'm very proud to say that we're delivering the best primary care pediatrics in the city, in the state, one of the best in the country. Our families here in the Brooklyn area have to travel a lot less further than they had to before for those services, and we all work together to deliver the best possible care.